Hi, I'm Dr. Hansen. I'm an expert in treating peripheral neuropathy. The symptoms of peripheral neuropathy vary from numbness, burning, tingling. Sometimes people have sharp shooting pains. Sometimes they have a rolled up sock feeling underneath their feet. Sometimes they feel like they're walking on barnacles or shards of glass. Many people have all of the symptoms. And if you have all of the symptoms, I can tell you right now that you have a combination of large fiber and small fiber neuropathy. Both are very detrimental for your future health, and both are an indication that there's severe damage taking place to the nervous system, and to the point where your nervous system is screaming out and saying, I'm not working properly, I need to have help. A little background on me. I am a board-certified chiropractic neurologist. Now, I'm not just a regular chiropractor, I'm board-certified chiropractic neurologist, and I am basically a situation where you get your chiropractic doctorate, and then beyond that you go 3 years of postgraduate work. There's only about 471 in the entire world with that particular expertise. I utilize that expertise to help you with your peripheral neuropathy disorder, and I treat the symptoms associated with, and I take care of the symptoms associated with diabetic neuropathy. We're not treating the diabetes necessarily, but we're treating some of the functional aberrations that cause the neuropathy. And we get great results with diabetic neuropathy symptoms. We get great results with chemotherapy-induced neuropathy. I've had many patients with chemotherapy-induced neuropathy, and their symptoms have gone away. And idiopathic peripheral neuropathy is another common label that people are given, and it is basically a way of saying that we don't know what the cause is, and you're just going to have to live with it, and we don't know basically what is causing it and what to do about it. But here's some gabapentin, here's some Neurontin to help you with the pain, and people are given some drugs to try to help with the pain, but realistically, if you're having numbness or tingling, it doesn't do anything for that typically, and many people report adverse side effects. They feel groggy, they feel loopy, they don't feel themselves when they're on the gabapentin. And it really ultimately is just a panacea or a cover-up to the root cause of the problem. It's going after the symptom versus the root cause of the problem. So that's kind of the approach. The approach that I take in my office is to take you as an individual, figure out exactly what kind of neuropathy you have, because most people get labeled with peripheral neuropathy and they have a very specific type. It can be type 2 or a large fiber neuropathy, it can be small fiber neuropathy, it can be a combination of both. If you have numbness, tingling, sharp shooting pains, that's typically a large fiber neuropathy. If you have burning pain, hot and cold sensations, or dysregulation of temperature, meaning your feet are cold all the time or hot all of the time, that's typically a interference with the autonomic nervous system, which are small fibers. I'll go into that in great detail with you, and you in the room, and we will go through and specifically address your particular condition and what exactly needs to be done to help you as an individual. What makes me different than many of the neuropathy treatment programs out there is that I'm not sticking you in a box and giving all of you laser therapy or all of you, basically nutritional protocols that are the exact same, or doing massage therapy on the foot or acupuncture or anything like that. We're basically specifically tailoring a treatment plan that is unique to what's going on with you as an individual, and we are attacking it and really treating it and going after the root cause of the problem, utilizing functional neurological modalities or treatment processes, as well as functional medicine, meaning targeted nutritional protocols that are necessary in order to allow your nerves to get the proper fuel supply, the proper oxygen, glucose, and activation that they need in order to kind of heal and get back to the point where they're healthy again. So my goal is to help you in any way I can. I would love to be able to be given the opportunity to meet you face to face, sit down with you, talk to you about what's going on with your neuropathic symptoms and your peripheral neuropathy, and come up with a solution so that you don't have to suffer one day longer than you already have. And we specialize in this, and we do great work. And it will not cost you a dime to just come in and talk to me. I will do that out of my own time. I will take time out of my day to have a consultation with you, and I'll do a neurologically based neuropathic evaluation. I'll check your feet, I'll check the different receptor sites, what types of receptors are being not working properly, which type of nerves are not working properly, and I'll go over that with you and explain to you exactly what's going on, and we will go from there as far as a treatment program. But that would be the first step. Take the first step, give my office a call, and come in for a free consultation. Tell them that you saw me on my website and you wanted to come in for a free consultation, and I will do everything I can to help you. Okay? So if you have any questions, call 425-558-1266, 425-558-1266, and speak to anybody there, and they can set you up for a time. Okay?